My name's Patrice. So just as a reminder, there is a telecoil in the room if anyone wants to use their T-switch on their hearing aids. My name's Patrice, I'm one of the other audiologists here, and I'm talking today about communication strategies or listening strategies, and for hearing impaired but also people with normal hearing. So as Dr. Flanagan has spoken about this morning, there's two main types of hearing loss. There's conductive hearing loss, where there's something stopping the sound getting through here, generally, so a problem with the bones or in your ear canal or outer ear, or sensory neural, which is normally a problem with the cochlea or beyond, so the auditory nerve, so somewhere from the cochlea or beyond up to the auditory cortex. So what do hearing aids do? Hearing aids are an amplification system to help if you have some hearing loss. They're generally more appropriate for sensory neural hearing loss, which is the more permanent, not always, but often the more permanent type of hearing loss. And there's several different styles of hearing aids which are suitable for different types of hearing loss. And Bruce will be talking about that later on. So, even when you're wearing hearing aids, often people come to us and they're still having difficulty in many situations, in particular very noisy restaurants or clubs, in small groups even, shopping centres, whenever there's background noise around, or in the car as well. So you can see in this picture just here, this was one student in the UK's solution. So we could all wear a bubble around our head, and when you wanted to talk to somebody, you connected the side of the bubble so that they could hear. I don't think it will necessarily take off, but it is one option. So what are listening or communication strategies? The aim is to improve the speech signal for a hearing aid user or someone with normal hearing so that they can pick up more speech. And the main reason for this is to try and help limit or prevent any communication breakdown. And then the communication flows better and communication tends to be better overall, and we have less misunderstandings. So effective communication is really important, and it starts with, if you require hearing aids or have hearing aids, with wearing them, okay? You're not going to get much benefit from them if they're sitting in a drawer. The other thing is telling people that you have a hearing loss can help. People then tend to give you more leeway, so they're aware that you may have some difficulty. And visual cues are really important as well. So getting somebody to face you so that you can see their body language and any lip cues is really important. So this is a study done by Marquides that shows how well we hear in different situations. So down the side here is the percentage of sounds that we hear. So, and across the bottom is how quiet, it goes from very quiet situations through to very noisy situations. So you can see we're going from sort of one-on-one speakers through to a party. Now, the red dotted line across the top is ideally we'd like to hear 100% of things in every situation, okay? Now, the green circles, they demonstrate what someone with normal hearing can hear in those situations on average. So you can see in a noisy party situation or on the street, someone with normal hearing is only hearing maybe 65 to 70% of the speech that they can hear. So taking away our visual cues and things like that, they're still not getting the full signal. Okay. So this line that's been added here is actually how well you can hear with one hearing aid in if you really require two. So you can see in quiet situations you do fairly well, but as soon as there's any background noise, you have a lot of trouble, okay? We're looking at maybe 10 to 20% with any background noise present. So really one hearing aid is really good for one-on-one situations. As soon as there's any background noise, we're not getting enough information. Now, two hearing aids, okay? So you can see that in quiet, two hearing aids are slightly better than one. As soon as you're in some background noise, it's much better than with one hearing aid. Now, the important thing to also take away is that hearing aids can't fix your hearing. They can't correct it. They're there to help with communication, to ease any frustration so that you can hear more clearly. So we're not going to get it back to normal hearing, and we're not going to hear 100% of things all the time. There's still this gap, but it's much better than with one hearing aid. So 2 hearing aids are generally, in most circumstances, better than 1. Okay. Now, common places and issues that people have hearing, even when they have hearing aids, or if they, even with normal hearing, when the acoustics of a place isn't favourable. So if there's a lot of reverberation, if there's a lot of distance involved, so if someone's talking from quite a way away, if there's a lot of background noise, and then as a result, conversation can break down. So acoustics. Reverberation with things like hard floors, hard ceilings. There's a spot just up the back there. There's just too much cabling to stand here. Just tucked in there. You could have a seat just in there. So, for example, I'm sure many of you have been to a restaurant with hard low ceilings, hard floors, hard furnishings, the kitchen open in the restaurant, and have a lot of difficulty hearing. Okay? So what some places do is they use various acoustic treatments, such as you can see in this photo, these soft panelling up the top. The idea then is they absorb any sound that would normally reverberate, they absorb it to try and make it more acoustically favourable for you. We can also try and keep background noise out of our environment. So things like double glazing windows, especially on busy roads, rubber seals on doors. I'm sure if any of you have had a hearing test with us, you might have seen some of the treatments in a lot of our rooms. There's, for example, in my room, there's panelling on the walls, double doors, various things to try and keep the sound out. Now, distance. When someone's a long way away, every time we're further away from someone, the volume of speech drops. So there's a few options that we can do. Things like asking them to speak a bit more, with a bit more volume. The most important thing is often, once they're at a certain volume, rather than yelling, to speak more slowly and clearly. Not to over-accentuate, because if you over-accentuate, you can distort the signal that you're after. So you're losing then the visual cues you would normally get. You can also change the position. So either you move closer to them or they move closer to you. So for example, if you're out to dinner and there's a long table of 10 and you're trying to talk to the person at the other end of the table, rather than trying to yell and miss everything, you're better off swapping positions with someone or thinking about it when you get to the restaurant who you want to talk to and try and sit next to them so that you have a better chance of hearing and having a flowing conversation with them. For situations where we can't reduce the distance and there's still other factors involved, such as, for example, a lecture, you can use assistive listening devices, which I'll discuss more later. So in background noise, what can you do? So if the background noise is outside, you can do things like shut the windows. If it's the TV and you're talking during the ads, mute the TV, turn the TV off, reduce the volume. If it's the radio, turn the radio off while you have a conversation. If you're doing the dishes at the sink and someone's talking to you from behind, stopping doing the dishes and turning around and facing them, all of these things will help you get a better signal and also mean that you can concentrate on the conversation rather than doing several other things and jumping in halfway through the conversation. So it's also really important that people get your attention before they start talking to you so that you're listening from the get-go rather than joining in halfway through the sentence. Like a pub or a restaurant and it's really noisy in the room you're in, you can always try and change rooms so that you're in a quieter room. Or if, for example, you're on the telephone in the lounge room and the dishwasher's going, the dishes are happening, the TV's on, changing rooms so that you're more likely to hear the telephone is always a good idea rather than trying to compete with all the background noise. So, When you can't get rid of the background noise, what do you do? Position in the room can be really important. So if you're standing in the centre, the cocktail party scenario is always the one described. So if you're standing in the centre of a room with 20 or maybe even 50, 60 people around you, and they're all talking, you're having a conversation one-on-one, you're going to have a lot of difficulty in the middle of the room because you're trying to pick one signal from the 50 or 30 coming from that direction. If you move off to the side, already the noise is mostly on one side. And especially with hearing aids, if you try and put the noise behind you and who you'd like to talk to in front of you, it can improve the signal that you get, okay? Because you're also only trying to pick the one signal in front, and you're not trying to pick up the several other signals that would have in the past coming from that direction. So, for example, at a dinner table, if you're a table off to the edge, as far from any noise sources as possible, so that noisy restaurant we were discussing before, if the kitchen's there, as far from the kitchen as possible, off to the edge with the noise behind you and who you want to talk to in front of you. And being as close to the speaker within reason as possible helps as well. And things like soft furnishings, so restaurants, there's a lot of acoustic treatments, but soft furnishings also absorb a lot of sound. So whether it's carpet, tablecloths, a lot of places have booth styles at the moment, and they're quite good for noise as well because your table's a bit more isolated from the other tables around you. The other thing is repair strategies. So when communication does break down, how you recover that conversation to make sure you can continue where you left off without there being too much disruption to the rest of the conversation. So the most common one people do is ask for repeats. I'm sure all of you have probably done that at some point. I've done it occasionally myself. And it's a very useful tool, except that often if you're constantly saying pardon, pardon, you're asking for repeats of the whole sentence and the conversation stops in its tracks while you're trying to gain this information. Another way around it is to say things like, I heard that you said we're going out for dinner on Friday, I didn't quite catch what time. Or you can repeat what you did hear and say, I missed the last bit, or what was the first word. So by asking for a specific aspect of what you missed rather than the whole sentence, you're more likely to be able to pick up that conversational flow, and your communication partner is less likely to become frustrated. Another thing, if let's say, for example, you miss the whole sentence, you could say, would you mind just rephrasing that? Because sometimes it's the particular words you have difficulty with. Trying in a different form can mean that you pick up a bit more. Gestures and visual cues are really important. So a lot of people talk a lot with their hands, so sometimes that can give you an idea of what they're talking about as well. And especially with appointment details, so for example at the doctor's with the receptionist, writing the information down so you have the correct date and time of your appointment so that you're there, there's no miscommunication there. So if in doubt, you can always write especially times and dates down. Other communication strategies are things like corrective strategies. So asking who you're communicating with if they could just speak a little bit more slowly, because especially if they're excited and then they start picking up their pace, it can be a little bit more difficult to pick up what they're talking about. Another good strategy is anticipating what the conversation, or in meetings in particular, what the information will be about, so that you know the vocabulary that might be used, what sort of questions might be asked. So by preempting that information, it can make it easier for you to follow what's happening, especially if it's an environment that you have difficulty hearing in. So, for example, at a meeting you might have access to the previous minutes so that you can see what's on the agenda for this meeting. It's a lecture, there may be a summary of what the topic's about, or even going to see a film, reading the synopsis beforehand. You then have a general idea of where the plot's going and the main characters, so then you can follow what's happening from there on in. Another really important thing, as I've said before, is telling people you have a hearing loss. It's really important. And also you can change what sort of questions you ask. So, for example, rather than saying, what would you like to do on Friday? You can say, on Friday, I was thinking we might go out for dinner or go and see a movie. So then you only have the two possible answers rather than an unknown, an open-ended question where you're not sure what the answer would be, especially if you're after specific information. If you offer either options or you ask a question with a specific answer, it can make it a bit easier to communicate. As a side note, amplification is used in a lot of classrooms around Australia, and reverberation can be a significant problem in classrooms, especially in primary school classrooms, whether the children have a hearing loss or not. And also, a lot of children, especially in primary school, can have middle ear infections. While they have that infection, their hearing is impaired. So you can see in this diagram here, here's the teacher at the front, and the original signal is the red. So only the first two children in this class are receiving the original signal, and the rest are all receiving reflected signals. So they're not getting as clear a signal of what the instructions the teacher's providing. With sound field amplification, the teacher wears a microphone. It's a slightly different style to what I'm wearing now. And there's speakers placed around the room so that every child can hear the teacher just as well, regardless of where they are in the room. And it helps. The idea is to then so that they all have as best chances possible of learning it in as good a listening environment as they possibly can. Something else that's really important is captions. So captions, they're available on the TV, on a lot of DVDs, some cinema sessions and some theatre showings as well. Now, there's basically, with TV, they're on the primary free-to-air channels between 6 and 10:30 at night on any news and current affairs programs, and also there's many caption programs in the TV guide on top of that. The Media Access is the organisation who arrange captioning, and they have all of that available on their website. Now, there's two types of captioning. Closed captioning is what you select, and if you look for this symbol here in your TV guide, that will tell you whether the program is captioned or not. Open captioning is more what they do in the cinemas. So that's where it's available for everybody who attends that session, whether they're hearing impaired or not, or are after the captions. So you can ask cinemas if they have any open caption movies, and Media Access also have a list of showings of any theatre productions or movie screenings that are showing captions. Shush, Self-Help for the Hard of Hearing, also have a library of captioned DVDs that are caption enabled as well. So devices that help improve communication. On top of listening and communication strategies, there's assistive listening devices, or ALDS, and they help with the TV, telephone, and in background noise. And they're available from many organisations such as Printacall, who are here today and arranged the telecoil for us. Shush, so Self-Help for the Hard of Hearing. They have, so do Printacall, an opportunity for you to trial them in their store. And you can also discuss it with your audiologist and see what's compatible with your hearing aids. So ALDs, there's a lot of different types. So for example, I don't know if any of you use them, but you can get headsets specifically for the TV so that you have your own volume control and everybody else in the family can have the volume that they would like on the TV, so they're not being blasted, but if you tend to have the TV quite loud. There's devices such as personal amplifiers, which sometimes we'll consider if, for example, somebody can't manage hearing aids or doesn't want hearing aids, and they have a very particular situation where they're having difficulty, and it's basically, it looks like a Walkman almost, where you have a microphone that sits here, and that picks up any signal around, and then you wear a headset and you get the amplified signals through the headset. Telecoils are also a form of assistive listening device in a sense, because you're then getting a signal through another form. So, for example, the one set up in this room, a lot of public spaces have telecoils, so in cinemas, churches, courtrooms, and they're often labelled with the telecoil symbol. FM systems are very good for background noise or distance, and they're used a lot with children in a schooling environment because they work very well with one main speaker, as the speaker would wear a microphone and the child would have shoes on their hearing aids that detect the signal from the FM system that the teacher's wearing. A lot of adults use them as well in background noise so that they can either, some people even in meetings, put the FM system in the middle of the table to allow them to better pick up the signals all around. There's also a lot of proprietary-based equivalents. A lot of the manufacturers who are here today, they have equivalent systems as well that are compatible with different hearing aids. So the reps who are here today would be able to tell you which systems they have that are compatible with that. A lot of them also use Bluetooth for this connection. And so, for example, you can have, for example, one company has a couple of companies have a streamer or a remote that hangs around your neck, and that can have a Bluetooth connection to your mobile phone. That Bluetooth, that then sends a signal up to your hearing aids. So it's all controlled via this intermediary device. They also have, several of the manufacturers have devices that plug into the back of your TV or to your landline so that you can get an amplified signal through your hearing aids via this intermediate device for you to pick up the signal, so that you're using your hearing aids as well, and you're reducing that background noise, so you're getting what we call a better signal to noise ratio. Things to take away today are, if you can, reduce background noise, face this person who's talking to you, reduce the distance between you and who's talking to you, disclosing that you have a hearing loss if the situation is appropriate, and thinking about where you're standing or sitting in a room. Now, if you're after any further information, please feel free to come and talk to us or send us an email. Depending on any interest, we may run what's called the ACE program if there's a lot of interest in it, which is group sessions on communication strategies. And there's a reference. So, does anybody have any questions?